Good afternoon, everybody. Welcome to our Nursing Now challenge for today, which is about female genital schistosomiasis, or FGS for short. We'll call it FGS because it's a bit of a mouthful. So just to introduce myself, to start with, my name is Caroline. I'm a reproductive health nurse specialist here in the UK. And I also work in neglected tropical disease control with a particular focus on schistosomiasis, which is bilharzia for many of you. So welcome to this session this afternoon. We're going to talk you through, I'm going to give you a brief overview of FGS itself for those who were not able to join on Monday. And then we're going to move across and talk about the challenge, and I'll introduce you to my colleagues and the other panelists for a bit of a discussion. And feel free to please post any questions you have in the Q&A or in the chat, and we can come to those at the end. So just to start off with, before we begin, I'm just going to give you all a scenario, and I just want you to have a look at the scenario and have a think about it, and we'll come back to it at the end. So this is just for your own thoughts. So in this scenario, a 20-year-old female in a rural village in Ghana presents to her local health centre with the following symptoms. So she has blood in her urine, she has pain on intercourse, and also she has quite severe genital itching or burning. And these symptoms have been going on for quite a few weeks. So if you saw this female in your area of practice where you work, what would you be thinking and what would your actions be? So just if you want to make a note now, just for a minute, and then we'll come back to it at the end and we can have a discussion based on what we're going to talk about today. And while you're doing that, I'm going to show you a short video to start us off.
This is a 14-year-old girl living in one of many countries in sub-Saharan Africa. She helps her mother with the daily household chores, washing clothes in the river, and watching her siblings swim nearby. Recently, she felt unwell, complaining of pain in her abdomen, seeing blood in her urine, and feeling discomfort and itching in her genital area. At the clinic, she was scolded by the nurse, who asked about her sexual history even after she explained that she wasn't sexually active. Like many young women in Africa, she likely has female genital schistosomiasis, or FGS, an infectious disease caused by a parasite living in freshwater aquatic snails. Though FGS is not commonly known in endemic communities or in local clinics, it remains one of the most important neglected areas in the reproductive health of women and girls, with an estimated 56 million infected worldwide. Among the impacts of untreated FGS are infertility, an increased risk of HIV infection, and associated stigma. To support women and girls affected by FGS, we have launched the FGS Accelerated Scale Together FAST Package project. The FAST package combines 4 intervention areas with highest impact and sustainability: training of medical personnel, improved diagnosis and treatment, awareness and prevention of new cases through preventive chemotherapy. The FAST Package project works with its network of global partners to reverse the neglect of FGS, ensuring that women and girls in sub-Saharan Africa have a better chance for healthy lives.
So as we just saw in that short video, I hope that was helpful to start off with. For many of you may not have heard of FGS before. So FGS is a complication of chronic schistosomiasis hematobium infection, otherwise known as bilharzia. Now, schistosomiasis is both an acute and a chronic disease, which is caused by parasitic worms, which are found in freshwater bodies. And this parasite is most commonly found throughout Africa, but it also lives in parts of South America, the Caribbean, the Middle East, and also in Africa. So disease transmission occurs through contact with these freshwater bodies where aquatic snails breed and they release the parasite, which then burrows through skin on contact with water. So the people become infected when these parasites penetrate their skin once they're in infested water. And transmission can also occur when people suffering from schistosomiasis contaminate these freshwater sources with urine or feces, which contain parasite eggs, and then these eggs then hatch in the water. So you can see how it's a cycle. Once somebody has become infected, a woman, the symptoms are caused when parasite eggs become deposited or lodged in the uterus, the vaginal wall, the vulva, or the cervix. And chronic infection can lead to inflammation and lesions forming in the reproductive organs. So women and girls in endemic areas become infected following exposure to this parasite in infested water during daily activities. So that's women and girls who don't have access to clean water or adequate sanitation. Those communities are particularly at risk. So just to show you, give you an idea, so you can visualize the anatomy of FGS, you can see here these little yellow schistosomiasis hematobium eggs, which become trapped and lodged in body tissue. They can affect the whole reproductive organs and the reproductive tract, but also the urinary tract as well. So they can also infect the bladder and the urethra as well. In terms of complications of FGS, these are complications, and we're talking about sort of chronic infection. So once a woman has had schistosomiasis for quite some time, she can experience, and these are quite common complications, so abdominal pelvic pain, disorders of menstruation, pain during intercourse, vaginal bleeding after intercourse, inflammation of reproductive organs, genital lesions, miscarriage, ectopic pregnancy, and also infertility. And all of these complications are linked to stigma. So the woman or the girl affected suffers from huge stigma. And in some communities, this can really have quite serious consequences, such as, for example, gender-based violence or social exclusion. Therefore, women suffering from FGS are therefore more likely to experience severe mental health consequences, including depression. In terms of diagnosis, the method for diagnosing schistosomiasis as a disease is a simple urine test. So you can detect eggs in a sample of urine using a microscope, but diagnosis of FGS is much more challenging. It's most effectively conducted through visual examination, so through pelvic examination and visualization of the cervix and the vaginal wall, ideally using a colposcope. However, there's a lack of expertise and often a lack of resources to conduct these type of examinations, so which makes it quite difficult. And current laboratory techniques are not always appropriate for diagnosing FGS. Another huge barrier, if you like, is that clinicians and healthcare workers are generally unaware of FGS as it's not included in training, and therefore symptoms are very often misdiagnosed, which results in inappropriate and ineffective treatments. This incorrect diagnosis can lead to unnecessary treatment, for example, with antibiotics, which are not appropriate and not effective, and clinical investigations and that fail to reverse the symptoms. This then results in multiple visits to healthcare services, and that therefore increases the burden on the healthcare system as well as on the individual. And very often this misdiagnosis leads to the stigmatization amongst women and young girls who might face judgment for bad behavior, and they have to go through unnecessary treatment and clinical investigations which fail to improve their symptoms. So physiologically, emotionally, and also socially, women and girls with FGS suffer a huge amount. This is quite a good illustration of this cycle of misdiagnosis. So if we're looking up here in picture A at the top, you can see that the woman presents to her local health centre, her local health post, and she leaves to receive treatment at her local pharmacy. She's told to go and receive treatment at her local pharmacy, where she's most likely treated for a sexually transmitted infection because her symptoms are very similar to those of an STI. And this leaves her with the same symptoms. She's given inappropriate treatment, the treatment doesn't work, and so the cycle continues. She goes back to her health post and she's sent back to the pharmacy. And this cycle can be repeated quite a few times. Sometimes she might be referred to the next level health service or health centre here in C, diagram C, where again, she's probably most likely treated for an STI. And she then may be referred on for antibiotics or to a further hospital health centre where she might be treated again for an STI, but her symptoms do not resolve because she's not been diagnosed correctly. In terms of burden and impact, FGS is estimated to affect 56 million women and girls across sub-Saharan Africa, but this actually is an estimate and we don't actually know the true burden of disease because cases of FGS are not diagnosed and they're not reported through the health system. Estimates also show that up to 75% of women infected with schistosomiasis could suffer from symptoms of FGS. And the burden of disease is high amongst young women, 18 to 29-year-olds. It has also been identified as a leading HIV/AIDS cofactor in sub-Saharan Africa. So it's associated with a 3 to 4 times greater risk of HIV acquisition, but also HIV transmission. So it's been identified there's a very significant geographic overlap between HIV/AIDS affected communities and those with a high prevalence of FGS. This relationship the causal relationship between HIV and FGS has not yet been fully understood, but research is ongoing and more research is definitely needed. Data has also shown an association between FGS and HPV, which is the virus that can cause cervical cancer, as FGS of the cervix can affect the body's immunological response to HPV infection. So there's also a risk of cervical cancer with FGS. In terms of treatment, praziquantel is the drug used to treat schistosomiasis. It's a deworming tablet effectively, but it's not necessarily effective at reversing chronic infection from FGS, including genital lesions. What happens with, once you've been treated with praziquantel, the adult worms in your body are killed and they can no longer produce eggs. Therefore, treatment can reduce inflammation, but it's also essential to prevent new lesions from developing in a woman's reproductive tract. So therefore, regular treatment with praziquantel from an early age can prevent chronic infection and other associated pathologies. And studies have shown that women treated at least once in their lifetime are 50% less likely to develop FGS. Research is currently ongoing as to whether praziquantel can actually successfully reverse the symptoms of FGS altogether, particularly genital lesions, as well as studies to look at what is the optimum dose of praziquantel to do this. So what we're now thinking about, and many countries are now adopting this sort of algorithm, if you like, is what we call presumptive treatment. So if a woman presents with symptoms in your clinic, you can, and she has one of these symptoms below, one or more, so abnormal vaginal discharge, bloody discharge, infertility or burning sensation in the genitals, and she's had water contact at any time in her lifetime in an endemic area for schistosomiasis, then you can treat her with praziquantel. So you don't need a colposcope, you don't need to be able to perform a pelvic examination. You can actually treat her based on her symptoms alone and the fact that she lives in an endemic area. And this is now an acceptable pathway to follow, treatment pathway. Praziquantel is a very safe drug. It can be used in pregnancy and it's very effective. And also you should be thinking, if you're treating a woman with praziquantel, if you're suspecting FGS and you treat a woman, you need to also think about all the other women who live in her community, in her household, and who have access to that same water source, because it's very likely that they will also need treatment. So just to finish off before I pass over to my colleague, what is absolutely key is this idea of integration of services in order to tackle FGS, because it crosses over into many different areas. We talked about the risk of HIV, we talked about the risk of cervical cancer. So the idea now is to look at fully integrating services to offer this holistic, people-centered care for a woman who's suffering from FGS. And in order to do this, you need to have integrated programs, you need to have a multi-sectoral partnerships within the country, but also globally, to ensure that you have this holistic approach to address FGS. So just to move quickly on to the challenge that we are presenting you with today. The challenge here is to develop a plan to raise awareness of FGS. So this is absolutely key, is the raising awareness. And it needs to be done through an existing program, platform, or a service within your community. So the idea is that we're integrating with a program that's already there and already working. We're not trying to create something new. And we'll come back to the challenge again towards the end. In terms of context, you would need to describe the issues related to FGS in your country or your region or your district where you work, and discuss the impact of FGS on your nursing or midwifery practice. So thinking about all those women and girls that you may have seen in your practice that may actually have been infected with FGS and you didn't realize it at the time. And then outline the ways in which your experience could be used as a catalyst for change. And then you need to present a solution. So describe your solution and the ways that your solution will improve the situation in your country. And explain how your experience has helped you to develop this idea. We'll talk more about the challenge towards the end, but I want to introduce you to Ruth Alate, who is a senior nursing officer in Ghana, who is one of our subject matter experts on female genital schistosomiasis. She has been through quite extensive training, and she's going to talk to you now about her experiences and her thoughts around this challenge. So thank you, and I'll pass over to you, Ruth.
Thank you very much, Caroline, for the presentation. And building on from where Caroline left, it's actually not easy to adequately evaluate the health literacy of people we come into contact with. And the challenge that we are thrown today is to create awareness. So there's one thing that we all have to know. It is important to take certain universal precautions before you even think of starting the awareness creation. We all have to assume that most of the people we come into contact with may have some difficulty comprehending health information, and especially FGS. So you can see my outline for the presentation, and we'll be talking more of how we are going to go our way around the awareness creation. Caroline has said a lot about the context, but I'm going to throw more light on this ones. Next slide, please. As Caroline introduced me, I'm from Ghana, and as you can see on the slide, that is our various regions that we have. We used to have 10 regions, but now we have 16 regions. So just in case you want to search on something about FGS and Ghana, you might come across any of these two maps with the levels of endemicity. Next slide, please. So we have a population of about 32 million plus, land size of 238,533 kilometers, and the female population is about 15.32% according to the recent population and housing census done in Ghana. As I said earlier, we have 16 administrative regions now, and we are among the top 5 countries in sub-Saharan Africa. Approximately 20 million people are at risk of schistosomiasis in Ghana. And you can see on the map, all the dots you see show some levels or degrees of endemicity. Next slide, please. I'm sure you got excited when Caroline was presenting and you are in a hurry to put something down and start how to win this challenge. But it's important to have a strategic plan before you even start anything. It's very, very important because you need to consider certain factors. Are you even convinced that over the number of people who have been infected or affected with FGS, is it convincing enough for you? I don't know whichever region you are coming from, but globally, it is that huge number that people have, especially women and girls, are living with FGS, and we need to end this challenge. Some of the factors that you also have to consider is whatever you are thinking about, is it innovative? Is it something that has been done and you want to build on? Are there stakeholders that you can think of? Are there existing interventions that you think we can really add on, we can really ride on to bring the end of this FGS and the effects that is having on women and girls? So these are some of the things you need to think about. Within your facility or your community, are there internal partners? Are there people who are interested? Are there policies that are in favor of FGS? So these are things that you really have to be looking out for to enable you have a successful awareness creation. Now, you have to summarize your reasons why you really want to create awareness, the knowledge that you've gained. Caroline has said a lot, but is that all that you have? We have other resources that you can also reach out to. We have the WHO Atlas. When you check online, you see it, and then you learn more. You see how the service looks like when someone has FGS. There are policy manuals. You can find a lot of information on the WHO website on FGS. And this is how you build up your knowledge so that it will guide you as to how to go along with your awareness creation. Key action steps for the challenge with realistic timelines. I'm sure you saw the slide Caroline showed, and you have some timelines that you need to work within. If your awareness creation idea is going to go a bit longer than that, I'm sure you might have to look at it again and revise it. You need to set an objective that is really smart so you can be able to meet the timelines. Next slide, please. Problem identification. Thankfully, we have been given the problem. So that is awareness creation to be able to end FGS within the whole world, and then you are starting from where you are. Approximately 56 million girls have been affected globally. Do you want to be part of giving freedom to this over 56 million people that are suffering globally? So that is one thing that should be running through your mind. Associated health issues that they go through. Mostly they are misdiagnosed. They are judged as being promiscuous. because they don't know that something of that sort can lead to signs and symptoms that looks like sexually transmitted diseases. It has reproductive health issues. So you can even go to the extent of the woman becoming infertile just because you just went to a riverside, a stream to fetch water to complete a household chores. So this is what we have in our hands to deal with. But the good news is treatment is available. So why should innocent women, poor women, women who are trying to make ends meet, 56 million of them, just be suffering? Treatment is available. So this is something that you might have to hammer on in your awareness creation. Then all this that we've heard, I think sums up the fact that the time is now for us to start doing something about it. And we are all looking forward to your nice ideas that will help us get over this. What are some of the strategies that we can consider? Awareness creation can take many forms, and that will depend on where you decide to have your awareness. If you are working in the facility and you want to start there, that becomes your community. So in the hospital setting, like the teaching hospital, your community becomes your patients, your staff relatives, your patient relatives, and you have to work around something so that you'll be able to achieve this. If you find yourself in the outskirts of town, or in an area where you think it's an endemic area and you want to start your challenge there, what are the means of strategies that you can use to reach out to this community? So we have mass media. You can think of the radio, our traditional means, TV, televisions, public address system, and what have you. Depends on where you find yourself around the globe. You can also choose the newspapers, other print media. So you can have the flyers, posters, billboards. Some go with printed t-shirts, branded FGS with a take-home message, and that can go a long way. You can also combine one of all these strategies that we are talking about. You can have one or two, depending on your strategy, and then off you go. Currently, we are in a social media era, and a lot of things go faster. It reaches a lot of people when it's being streamed, when it's on YouTube, when it's on Zoom, Teams, live streaming, other electronic means. So you can think of whichever media strategy that will be good for your idea. So this is all something to let you know what ways you can craft your idea. But there's something that works better if you are within a community for you to ensure that whatever you've taught has taken some effect, or even there's a need to reframe your method. The teach-back method works better. So you can let the people that you've educated tell you what they've heard or what they understand, and then that will also help you. Next slide, please. Now, having gotten all this at your fingertips, you think about your audience. I have spoken a lot about it. What are the audience that you intend to create awareness on? Is it your core staff at work? Or is the community where you've received a lot of cases from? So these are things that you can think about. What are your targets? For you to know the target, you need to study your audience. So are they educated? That will also help you to choose the strategy. Are they people who easily understand? Do you speak their language? If you use print media, will it make meaning to them? One thing that is also undermining work of a lot of awareness creation when it comes to health issues is that if healthcare workers don't have the needed knowledge, it becomes difficult. So even if the person is infected and comes to the healthcare center and the person doesn't have knowledge about that particular condition. So as a healthcare worker, you have to make sure your healthcare givers are also educated, even if you think of a community strategy. You need to empower healthcare workers. The endemic community members. I'm sure a lot of areas, even though they don't go into rivers and streams to fetch water, some use fishing as a hobby. And that is one important thing for us to look at. When people come to a healthcare facility, what are their hobbies? What are their geographic location, their coordinates? These are things that will help us also identify endemic communities that are affected with FGS. Next slide, please. After you've put all this together, it's appropriate for you to test your idea, your plans, your implementation, everything that you have put together. Test it and see, is it feasible? Are you going to be able to achieve it within the time frame? Is it something that you can really deal with? If not, you can modify it before you implement. Next slide, please. This is a picture that is going to remind all of us that no matter what you are doing, you need to take photos. Public health, creating awareness is all evidence-based. You can't be somewhere and say you did something without anything to show. So this is a picture of a training that's the first package organized. So when you see the slide, remember to take your photos. Remember to provide evidence. Now, talking about my facility experience. Around the COVID-19 era, we have all adjusted to the new normal. All meetings that were held in-house were closed, and we all have to join one way of virtual meeting or the other. So by then, we have been empowered with female genital schistosomiasis knowledge. We've been trained and we've gotten all the skills to deal with. We did not just have to sit because COVID was around, but we were able to use Zoom link, and then people joined within the hospital and beyond. And it went very far. A lot more people were able to hear about what FGS is doing to women and girls. A lot of social marketing is needed when you intend to use a virtual means to circulate your message. Without that, the time will get there and then most people might forget, or they might even not be able to join. But it's important to also make your recordings available so that people who might have very tight schedules but still interested can reach out to some information. And for you to be successful in all that you are doing, teamwork is key. Where you are, if it's important for your heads of the hospitals, your facilities, engage them. And then the existing partners that are around, you have to engage them. Your healthcare staff, even when after engagement, people will be willing to voluntarily help you to achieve your aim. So this is very important, teamwork. If it's virtual means that you are going to go solely with your awareness creation, you always have to have the reliable resources such as internet and the others. Next slide, please. For the steps to consider for the challenge, I believe Caroline thrown a lot of light on it. And then we all have to consider all the factors that I've already spoken about. You consider the name of your community or the facility. You also have to look at exactly the reason why it's making you to create an awareness. Why are you actually passionate about FGS? Is your project an innovative one, or it's something that you just want to add on to what is already existing? Do you have any experience on FGS to share? Because that will also make a great difference in your project. List the available resources, the stakeholders that you have, and then existing interventions that you think FGS can be integrated with. you have to have your concrete action steps with realistic timelines for you to be able to achieve this dream. Thank you very much. And don't forget, together, we can all end the neglect. Thank you.
Thank you so much, Ruth. That was really fantastic. And Ruth has her own personal experience of when she went through the subject matter expert training on FGS last year. We ran a global training workshop and she was one of the successful applicants. She completed the training and she developed her own action plan. So she's actually, she's experienced firsthand what it means to put an action plan into practice from conception right the way through to its conclusion. So thank you so much, Ruth, for sharing that. I'm just going to move forward to tell you a bit more about the challenge. So again, just to remind you, this is your challenge. So please do make a note, but there'll be plenty of information online for you as well that we'll share with you. So the idea is to develop a plan to raise awareness. So you're not looking at diagnostics, you're not looking at treatment, you're looking at awareness raising of FGS through an existing program, platform, or a service within your community or your area of practice. So I would say really from the beginning, keep it really simple and really achievable. If you manage to raise awareness amongst 3 or 4 of your colleagues, that's already a really good achievement. And then at the end, you'll need to present a concept note. I'll talk about that in a minute, but all the guidelines on the concept note are on the Nursing Now Challenge Global Solutions website. So I think we can put that link in the chat for you, and all the guidance is there for you to read about in your own time. But the idea is that you need to prepare a short concept note which provides key information about you and your ideas. And here are the key dates for you. So we had an information webinar this week on Monday, and today is the launch. So we have revisited some of that information to give you a brief sort of a background into FGS. We will then be running some follow-up webinars in October, and these dates will be confirmed with you. And your deadline to submit your concept note is the 11th of November. So those are your key dates. And again, all this information is on the Nursing Now Challenge website. A prize, so once these concept notes have been submitted, they will then be judged by a panel of global health experts. And there will be a prize for the winner, which is $500, and also 3 months of mentorship with Ruth. And you've just heard Ruth speaking earlier. And these will be weekly sessions, but it's something that you can arrange between the 2 of you. But she has kindly agreed to offer mentorship to the successful person. So that's really fantastic. And there is also a requirement for the winners to provide a written update. This is about 500 words or less, so it's not very much, with some visuals, so some pictures or some video material to demonstrate the progress of your activity by February 2023. So you produce your concept note first, and then you put it into practice. So to finish with, I just want to go back to this scenario that I gave you at the beginning. So you have your 20-year-old female presents, she lives in a rural village in Ghana, and she presents with the following symptoms to her local health centre. So I want you to think back now to what you thought at the beginning, and are you still thinking the same thing? And what are your actions, and what are the key questions that you would ask? So maybe you can put some of those key questions into the chat now, and we can have a bit of a discussion. I'll leave you with the scenario. So I'm now going to, I'd like to introduce out some of our panelists. So what I will do is just stop sharing my screen for a moment. Okay, wonderful. So I'd like to introduce the first panelist. You've met Ruth. I'd like to introduce Stefan, please. If you'd like to say a little bit about who you are and maybe whether you have any experience of cases of FGS in your practice. And if not, maybe some thoughts on today, maybe what you've learnt or any questions. Over to you, Stefan.
Right, thank you, Caroline, and good afternoon from Ghana. My name is Stefan Osei. I am a newly qualified nurse currently practicing at the Konfanochi Teaching Hospital here in Ghana. And first of all, I'd like to say thank you, Caroline, and my own senior colleague, Ruth, for the wonderful presentation. I believe much light has been shown on very neglected tropical conditions like FGS. I haven't actually come across any case like that, but then again, it all comes down to the fact that we may have seen these cases or we may have come across patients who have these conditions, but the first thing that we thought of was probably an STI, because when I saw the first scenario, I was like, oh, this is definitely an STI. But one thing that I believe many health workers have is the ability to probe further, to look at the history. So if you think you're thinking STI, patients say, well, I have not really been sexually active, I don't have those risk factors, then there is a need to look at the other side of the story. So I think this is a very important conversation to have. Again, I would like to encourage anybody who has any idea on how to spread awareness on this and to develop that concept note and submit it, because you never know where your idea would take this whole issue to. I remember we also started a nursing out challenge just like this one, and then now we're going really forward with new.
I think we might have lost Stefan. Hopefully he can rejoin. So while we wait, I'd like to pass over to the next panelist, Ambrose, please. Would you like to introduce yourself and where you work and whether you have ever come across FGS or any thoughts you'd like to share from today?
Oh, thank you very much. My name is, first of all, are you hearing? You can hear me?
Yes, we can.
Yes.
Go ahead.
Wow, okay, perfect. So my name is Tumwesja Ambrose. I'm currently a student at Imbarara University of Science and Technology, Uganda. I'm very happy for the previous panelist on how she presented detailed information about FGS. I personally, I've never come across these cases, but I really think, like she discussed, it was due to underdiagnosis. Me, I got a feeling that we have been coming across these cases, but we have not been having any sensitization about them. Therefore, we have been missing out on them. So with this information, I'm going to read more and more about it, and then try to be more inquisitive if I come across women with such a symptoms, such that such a women with such a cases can be identified, and then right diagnosis made and they get right treatment. So it's a great idea to really do an innovation in this area, because schistosomiasis is spread all across Africa. So we can be agents of initiating proper diagnosis of this condition. Thank you.
Thank you so much, Ambrose. Thank you for joining.
Welcome.
Thank you.
Yes.
I also wanted to introduce.
Welcome, really.
Thank you so much. I wanted to introduce to you Cecilia,
Yes.
who is our next panelist. Cecilia, we met on Monday. If you'd like to say hello and who you
Oh,
are. Go ahead, Cecilia.
yes.
Good afternoon, everyone. I love that the presentation from Ruth. That was very wonderful. And well, I might have come across women with the FGS, but we always have been misdiagnosing them. Sometimes most of the cases go unruled out, and we may have diagnosed them as sexually STIs. So, and I think it's the high time we get maybe a frequent, maybe a routine series or training for, and especially in my context in Kenya, we have these cases in areas we have rivers and lakes, but especially in the lakeside, in the western part of Kenya, that is in Nyanza and Western, there's high prevalence of the HIV and AIDS, and most of these conditions I come hand in hand. They are similar, what you call similar condition, similar signs and symptoms with FGS. So I believe if they are integrated with these programs, if nurses are able to know how to definitively diagnose this condition, I believe it will be better for the country and also for the region. So, well, as an advocate, I would believe, as a patient advocate, as a nurse, yes, I would like to, maybe on Kenyan context, you can have a webinar to talk more about the FGS in our context on an available time. So, because many questions have really come up from Monday. They're telling me, oh, I want to know, I've never heard of that, but probably they don't know how to go about it. Yeah, that's something to think about. And I raise a challenge that the young nurses and the midwives should be able to try out this challenge as we launch today. And I believe it will go an extra mile in innovation and in advocacy for our patients. Thank you so much, Caroline.
Thank you so much, Cecilia. It's so nice to hear from you. And I completely agree with you. I think the key to take away from today is that it doesn't have to be complicated, the challenge, keep it really simple. And I think everybody on this webinar can achieve something. Everybody can do something to raise awareness using a program that's already there in their country. So try to keep it really simple and don't be afraid to have a go. I also I've just seen in the chat, we have Ibrahim Rabiu, who is the president of the FGS Society in Nigeria, which was launched quite recently. Ibrahim, are you still on the call? Can you introduce yourself? Because Ibrahim has a lot of experience, so maybe he's no longer on the call. I think maybe he's gone, but he was here and he
yes, I'm here. Yeah, it's a great opportunity to be here. Yeah, FGS is really a case, that most of the health workers in Nigeria, they are not aware of it. And as you rightly said, our society was launched in March, and then we were able to go, cut across, Nigeria creating awareness. We've used a Nurses Association to create awareness. We've used a Nigeria Medical Association to create awareness. We've used Medical Laboratory Society Association to create awareness, and we are still creating more. And also we are doing research. Recently, we published a case report about 76-year-old woman that had a cancer of the vulva with FGS. And also we are in some state doing research work. It's great to know about FGS, and then we are trying our best in Nigeria to create awareness. And we hope that the whole of Africa will do the same. Thank you so much for this opportunity. Over.
Thank you so much, Ibrahim. That's wonderful. I'm actually going to share a link now. So the FGS Society in Nigeria have a website. I'm going to share the link here in the chat, which has a lot of information. I've shared it there. Oh, one moment, sorry. Here we go. So I think we now have Stefan back on the call. Stefan, do you want to, I'm going to pass back to you.
Hi, yeah,
Hi.
yeah, sorry, I lost my connection. So I think I had just basically 3 points where we could look at the history of the patients we meet. We have an expanded history review. And then, of course, I was also trying to talk people into taking up this challenge if they have any idea, because it could be something small for now, but you never know where it will get to. And I think, yeah, that's what I was just trying to put across. Thank you.
Thank you so much, Stefan. Thanks for coming back and joining us. So I think I'm sure you have a lot of questions in the room, particularly for those who've never heard of FGS. It's a new topic, and it's also, for me anyway, when I learned about it, the impact is quite shocking in terms of the numbers of women who are affected, and that it's such a neglected issue, and also that it can affect a woman every aspect of her life. So not just physical, but also emotional and social as well, particularly for those women who go on and then realize if they then become infertile through FGS, that has very serious repercussions for them. So there's a lot of information, and we've really given you just a snapshot today, an introduction. So don't worry, don't think that you have to go away knowing everything. You don't. There's plenty of reading material in the chat. I would really strongly advise that you all go back to your area of practice where you work and just start to have a look around, ask some questions, and see whether you can start to pick up some cases or begin to think about identifying cases of FGS. I also just wanted to close. I wondered whether, with the scenario I gave you earlier, when I gave it at the beginning of the chat, of the presentation, I just wanted to get a sense of how many in the room were thinking that she had an STI. Maybe you could just put it in the chat, yes or no, STI, or what were you thinking at the beginning? And then what were you thinking at the end? I'm just wondering whether we can somehow capture that. So I'm going to wait for some of your responses in the chat here. Because as you've seen, one of the main problems, well, there are two main problems. One is the lack of awareness amongst healthcare workers, and two is the fact that women are very often misdiagnosed. So they are treated for an STI when in fact they don't have an STI, and it's not transmitted sexually. FGS is not transmitted sexually. It's a waterborne parasite, as you've seen today. Okay, wonderful. I'm just reading the comments here in the chat. So before we finish today, time is running. Do we have any other questions in the room? Please post in the chat or raise your hand. So somebody here's put, it's the first I hear about FGS. Someone else thought it was an STI, which is very, very common because the symptoms are really similar. So just to kind of end on a bit of a happier story. So I have a colleague in the UK who spent some time in Malawi, and this was about 15 years ago. She swam in Lake Malawi. She came back to the UK, and she had no symptoms, but she was unable to have children. So she went for a lot of tests, and eventually they diagnosed FGS, and they treated her with praziquantel, and she now has 3 children. So that's a happy ending to today's webinar, just to show you that it can be treated, but we are not sure what's the optimal treatment and whether it's always going to be successful. We don't know. So this research really is quite new, but it can be done. So I just want to say thank you to everybody. I hope I've introduced all our panelists. Was there anybody else that's not had a chance to speak? I think I introduced everybody. Thank you so much to our panelists for your contributions, and to Ruth for her amazing presentation and her amazing support for this challenge. Ruth's going to be your main woman. So I'll leave you with that. There's plenty of material. We'll be in touch with the follow-up webinars in October. So please do keep in contact and keep an eye out on the Nursing Now Challenge website for all the information, and also on the social media channels. So thanks so much to everybody, and we will see you in October. Good luck. Bye-bye.
Bye.